So we have a lot of stuff going on with us that you really don't know, and you can't see what is happening to me, but what comes out. We become such taskmasters in this whole process of caregiving that we forget them, and we just do the task. And that's always pushing your agenda on somebody else. And how does that feel? You're going to push away automatically. So for 6 years when I cared for Albert, everybody told me how wonderful he looked. Oh, he was so well groomed. Nobody ever told me one time how nice I looked. They didn't even know how long it took me to get him to look that good. But it became such a chore to say, oh, comb your hair, Albert. Tuck your shirt in. Oh, my gosh, your nails and your toenails and, oh, my haircut. You know, it was just one thing after another that the minute I would walk into the room, he'd say no. Now, Albert lost his language skills very early. He didn't say my name for many years. He said the swear words, of course, but he never said my name for many years. But what he could say very clearly is no. And before I would even get anything out, he would say no. Because all he associated me was doing something to him. An example is I always had to do his toenails, his nails. One day I walk in the bedroom, he's getting dressed, but he's standing there completely naked with his shoes and socks on. Guess what I wasn't going to play with today? His toenails. But you know, I'm pretty much have a big girl brain, and I go to the nail store every couple of weeks. Thought, what the heck? He comes with me. So I said, could you ladies take care of it? He was absolutely treated like a king. I thought, what the heck was I thinking? So I went to get my nails done. They checked his. Check. Didn't have to do it. I never saw him again naked with his shoes on. Because I did no longer, he associated me with that task. And we forget about the person. The person is in there. Truly, truly in there. We just forget it. And what I want you to try and do is not take things away from this person completely. Till the day we close our eyes, there's always a reason for us being here, and there's always a purpose. We just have to find that purpose, whatever it is. It's not an easy process by any means. So what is happening to this disease process? And I get lots of phone calls about my obligation to tell people about this cure or this remedy or this whatever. I don't have any obligation to do that, but to teach you how to interact with your person in a situation that you've been dealt. Because I can probably tell you that there is probably not a person that's living with dementia that is saying, you know, I've been really successful through my life. I'm in my golden years. What the hell? Give me dementia. I'm sure that there's probably not anybody doing that. On the same aspect, there's not any caregiver here that has said, I've been pretty successful, been married for 60 years. Let me be a caregiver to a person with dementia. I can probably guarantee you that doesn't happen either. So what that tells me is that you're both in a boat together, and you need to learn how to balance. That cure and whatever else people are saying doesn't help where you're at now. Getting your person in the shower, cleaned, dressed, to the doctors. What is happening to this disease process is that you are actually in brain failure. Your brain is dying. And it's dying from the outside in and the inside out. So it's shrinking, and as it's shrinking and the atrophy is leaving no good tissue. So when somebody says, oh, you can retrain the brain. You can retrain the brain after a stroke or some other ailment, that there is good tissue left. But you can't retrain the brain when it's taking the good with it. So what happens is we're losing the ability to connect with what we think, to what we do, to an action. Does that make sense? So as it's shrinking, by the end of this journey, it'll be the size of a toddler, which is 1/3 our size. So when I say I have the big girl brain, us as caregivers do have legitimately the big girl brain or the big boy brain. But when we're going through this journey, it's jello. And there's some cases where you think you have the disease. So I'll give you an example about a process. I went to work full time, so Albert could use the microwave, so I would always leave something like spaghetti or something in a bowl, put it in the refrigerator. He could heat up his coffee and his lunch. He was fine until this one day he brings me over to the stove and he points to the stove. I look at my bowl and the bottom is completely gone. He put the bowl on the stove. So no longer is the ability of using the microwave part of his rational thinking skills. So I left the sandwich in the refrigerator. I come home. Well, did you eat? Yeah. Well, your sandwich is here. Well, I ate. You must have just put it there. Well, did I just put it there? So then I had to leave the sandwich on the counter. What was happening is that kitchen was no longer a part of a room that he was really interested in. So it didn't matter where I left the food, he didn't feel hungry until I now had to come home, sit down with him, and cue him to eat. Because I'm not hungry. I'm not thirsty. How many people have a hard time getting their person to drink? And I can look around here that after 60, this is the last thing we want to do. Because after 60, we know what goes in has to come out. And we're not 25, and it comes out a lot faster. And we have to be there a lot faster. So we don't do this as much. At 25, I keep mentioning 25. At 25, our brain is at the peak. Is that not a waste? I mean, they're college, they're drunk, they're staying up all night. They can retain more stuff than we ever thought about, and they never use it. And remember when we were 25, you used to say, I think my mother has eyes behind her head because she's always watching me. Well, literally she did, because her peripheral vision was probably way back here. As we age, it comes in until we have dementia and it's here. So our peripheral vision does change after 25. Now, I mentioned something about the hearing aids, and this is something that is very different about this disease, and I mentioned this to someone. We don't have the support that we really need for this disease like they have with other diseases. I literally got the diagnosis for Albert, and I said to my doctor, well, what do I do? And as I'm asking these questions, what do I do? He is very kindly walking me to the door. And I'm saying, well, what do I do? He says, hang on for the ride. And that was what he told me. And in most cases, they'll say, you'll put him somewhere. That is such a harsh term, you will put him somewhere. So, you don't get the support or the understanding. People will tell you, this is how you should do it. But what we don't get is a clear-cut diagnosis. And that's a very difficult thing. For us women, as Arlene said, we get other baselines, don't we? Mammograms, PSA, bone density. We get all those other we get all those other types of baselines, don't we? And she asked if you get a baseline for your memory. Well, we don't normally, unless something happens. There's no protocol. So if I were to get a lump, you know that you're going to get another mammogram. You know that you have an appointment set up for the diagnosis, the treatment, and we're going to move through the process. I can sit at a table, and this happened. There was 5 women that sat at this table. All their husbands were diagnosed with Lewy body dementia, which is a real uncommon. It's not uncommon, but it's not real common, Lewy body dementia. They all had the same doctor, and they all were diagnosed 5 different ways, and they all had 5 different treatments from the same doctor. So when you start to see a problem with your person, number 1, you should go to the doctor and say, I see a problem, and ask for blood work. How many get blood work? Of course you do, every 3 months. Ask for blood work. Blood work for a person with dementia and trying to be diagnosed with dementia, which the process is we need to eliminate the things that it is not to determine it could be dementia. So we want to have a thyroid test. We want to have a vitamin B test, vitamin D. We want to have urine for any kind of infections, particularly urinary tract infections. They call them UTIs. But any kind of infection. And we want to check for dehydration, nutrition, those types of things. Now, as we age, things change in our body. You hear a lot of people say that they have low iron. They're losing blood. They're losing potassium. They're losing sodium. All that stuff changes. So if I have a thyroid problem, I can look as though I have dementia. I will be just as confused. I will have problems. If I have a low vitamin B or D, if I'm dehydrated, if I have a urinary tract infection, I will look as though I have dementia. They're not reversible dementias. They're medical conditions that can be changed once they're treated. Does that make sense? So once they've been treated, you don't have dementia. So now if we've had this blood work done and nothing is out of the ordinary, you want to now ask for an MRI. This is how your insurance is going to pay for it, because we're all run by insurance companies, correct? So we want to do an MRI. The MRI is going to trigger your neurologist. So what you've done in the doctor's office in your primary cares. Now, first when you say there's a problem, they're going to go to you, just as Arlene just said, and they're going to give you what's called the mini mental test. This is quite amazing, because now we are doing this in less than 15 minutes, right? We don't see the doctor for more than 15 minutes. Medicare's only paying you to be there for 15 minutes. That's the law. I bet you don't spend 15 minutes in the waiting room, though, do you? So what they're going to do is, you're having a problem? Hey, I'm going to ask you a few questions. What town do you live in? What county are you in? What year is it? Who's the president? I'm going to give you 3 words: apple, table, penny. We're going to come back to that. And I'd like you to draw a clock for 10 after 11. Okay. And you're looking at them, and there isn't any way that you have now been calm enough to know where you live. You are right now on the spot. And if you miss 1 or 2 of those words, apple, table, penny, I can probably almost guarantee you that they'll put you on medication, because you might have dementia. And they have diagnosed you in less than 2 minutes with a terminal disease. And that's called the mini mental test. Did you hear what one of those questions was? Who's the president? That's the same exact test that they gave the president, too. I'm not kidding you. What I'm saying is, it's insufficient for us folks. How in the heck could it be sufficient for our president to be examined and be given a mini mental test just like that. It's not. So if I'm nervous, or maybe I'm tired, maybe I've had a bad day or a bad night, and I don't know what county I live in, maybe I'm a seasonal resident. I say Wisconsin, I don't know. Oh, you don't know where you are? You know what a person with dementia said when that doctor asked who the president was? He walked out because he went to go get his chart, and the person with dementia looked at his wife and says, "We got to get the hell out of here. Why am I with a doctor that doesn't even know who the president is?" But this is what they will do, and they will sometimes give you that medication that is only used for cognitive issues before they will do an MRI and before they will get those results. So an MRI will trigger a neurologist, which, okay, we have a primary care, we have a neurologist. And the neurologist could sometimes see an atrophy. And everybody knows what atrophy is, that it's just no longer working. It's dead, dying, whatever it might be. You might see that there's atrophy in the brain. Now, this is another quite acute thing that they do. So after that 25, you have normal decline in your memory. We all do. So normal is like this, okay? Alzheimer's dementia is like this. So now that person reading the MRI looks over and says, well, this person is 70. Is this more than what is average for a 70-year-old? Then they say that, yes, they have atrophy. So that's kind of subjective. In my particular case, they said that Albert had mild atrophy. When I finally went to the psychiatrist, there was no way he had mild atrophy. He could only do one thing at a time. So it's all very subjective. Now, the medications that they use, and why this is so important for research, is we have never had a medication designed for Alzheimer's. In more than, 19, 20 years, if we ever had a medication that was just for Alzheimer's. What we're using is medications that are used for bipolar and schizophrenic behavior. That's what we're using. There's 4, and they've taken 2 of them and created one pill that makes 5 medications. That's all we use. Anti or psychotropic meds should be managed by a psychiatrist. If anybody has gone through this journey, has any one of your doctors said that you should go and consult with a psychiatrist? Oh, really? That's surprising. But that should be your team. Your neurologist reads your MRIs. If you want to have another one in a year or so to see if there's any differences, that's what triggers the neurologist. We always go back to our primary because we have medical conditions, and we should be dealing with our psychiatrist to help us manage the medications for our behaviors. Now, a good example of what a psychiatrist has told me is, here's dementia here, okay? Here's anxiety. You might see anxiety like, I gotta get out of here, we gotta get out of here, it's time to go home now, come on, we gotta go, now, come on. And I will pace, and I won't be able to stop. And if you don't get my need met, I'm gonna continue to pace till I don't eat, sleep, or drink. And who else isn't gonna eat, sleep, or drink? There's 2 of you. So that's anxiety. The other one down here could be depression. Oh, honey, I don't wanna go to the store today. No, you go. But you always go with me. I don't feel like going. I just wanna sit here and watch TV. Just go. Lack of initiative, depression, sleeping. The dementia is here. We can't fix the dementia. But what is coming out are these things: anxiety, depression. In some cases, we see post-traumatic stress disorder, depending on how they've been treated or from the service. What we have to do, and what the psychiatrist is geared to learn, is what is causing the anxiety so we can bring them down. so that we can manage the anxiety, which makes the dementia easier to manage. Does that make sense? And we want to bring the depression up so that we're able to manage the dementia. There's always probably going to be a time where any of the medications you use are going to not work because the disease will surpass that ability. Does that make sense? So what we have to use is what they have left. And the one thing that they have left till the day they die is their feelings. So if you go online and you look at scans of a normal brain, an Alzheimer's brain, a late stage, and an 18-month-old toddler, you will see that the late stage Alzheimer's brain is the exact same as that 18-month-old toddler. It's all about the feelings. Your toddler will let you know if she doesn't want to go to that daycare, right? Or if they don't like that person, they'll let you know. A person living with dementia will do the same thing. So when I am losing all of these things that are happening to me, the only thing I have left is how you make me feel. I'll give you an example. I keep talking about Albert. One story I'm going to tell you about things this close to your nose and you can't see that is in Citrus County, we have what's called Fanny Farmer's Outlet. Oh man, when we first moved to Citrus County, he took me there. I thought I died and went to heaven. After I was done drooling, it was filled with chocolate. And then the things that had the black lines through it, they were like 50% off. You get 2 or 3 of them. We walked out of there with 4 bags of chocolate. Came home, put them in the pantry. I came home from work one day, pretty stressed, opened up that pantry. There wasn't a bag of chocolate, box of chocolate, not even a note said I ate it all. I went right to him and I started yelling at him, where's the chocolate? Where's those bags of chocolates? You know, all that stuff that we got from Fanny Farmer's, Russell Stover's, where is it? Where is that stuff? I can't figure out, where is it? And he just smiled. He has the most beautiful eyes, just smiled. I'm getting madder and madder. I got he's happy. He didn't even tell me he ate them, but I got myself in such a tizzy, I had to leave the house, go get a piece of chocolate at the store, and come back and cook him dinner. I was so bloomin' mad. About a month and a half later, he greets me at the door. Guess what he has? The 3 bags of chocolate. So it's now, he's standing there. We've all got the 3 bags of chocolate. What do? Where was it? Where'd you find it? Where did you put that? I wanted to know where his hiding spot was. Did you get that I had the 3 bags of chocolate? I could have done whatever I needed to do with those bags of chocolate. But it was right here that I had to start all over again. So when I had to start placing Albert outside the home, it was because he started leaving the home. And wandering is a big deal for our folks. And most people will say, well, my person won't wander. They don't leave me. They don't leave my side. Well, you have to go to the bathroom, and you may fall asleep in that chair, right? If you're in the bathroom and they go looking for you, or if they're watching TV and the doorbell rings and they go to the door and don't see anything, they're out the door, that's danger. They can be gone just like that. Somebody told me that in 15 minutes they can be gone a mile. They will primarily, a lot of times, go to their dominant side. So if they go out the door, they will go to their right if they're right-handed. And it could be as simple as going to get the mail and not knowing to turn around and just continue to walk. 7 out of 10 will wander outside their home and get lost. Albert started leaving the home. I had a bracelet on him from the Alzheimer's Family Organization. I did not have scent kits, and we'll talk about that. The sheriffs were called. He went about 4 houses, knocking on the door. Remember, no language skills, so when they say, who are you? He can't tell them. So they call the sheriffs, they bring him home. He goes out a second time, he's now a quarter of a mile. He goes out a third time, he's on the main street. Now the sheriffs are in my house waiting for me to get home. I know at this point his behaviors are telling me that he can no longer be in the house, he's not safe. So I had to start looking for care outside the home. And it didn't go well because he was mobile and people believed he was aggressive. He was aggressive, but what I didn't know was because of what we were doing. So he was kicked out of 3 assisted livings in a matter of hours, not weeks, not days, hours. And the one time I was called, he was handcuffed in the back of a sheriff's car. This is a person that is coming from a memory care unit. They know that he has dementia. They handcuffed him, and the minute he's handcuffed, they take him off to a psych hospital. It's a receiving center. And you're not allowed to see him for 72 hours. That's a law. It's called the Baker Act. Well, yes, it is. So they put him into this receiving center, and because he has Medicare, they don't keep him the 72. They petition the court. They actually have a court in those systems, and the Baker Act system asked for a requirement to keep him longer. So they kept him about 10 days, which is about the average in some cases for that. So they kept him 10 days. In that 10 days, he had the opportunity to be physically abused and emotionally abused because he went in there fully functioning and he left with briefs that hadn't been changed in many days with both feces and urine. So when I finally find someone that will take him, they delivered him in a taxi at 9 o'clock at night. No shoes. He was completely beaten down as a person. And Albert was a 20-year retired military. He was a test pilot for Lockheed Martin, and he was a helicopter pilot for Bell Helicopter in Iran with the Shah. So it wasn't like he was a stupid person. So then he spent about 2 weeks in a hospital that they 4-point restrained him. Now they're telling you they don't restrain anymore, but they 4-point restrained him and put a catheter in him. And you had to hire a babysitter. Really? He ended up in a psych hospital in Spring Hill for 12 weeks or 11 weeks. And at this time, nobody wants him. But we've already determined that I can't keep him safe at home. I work full time. So someone decided that they would take a chance on him. I was not nice. I was not nice. I won't even tell you. You know those words that he used? I was not nice. And so this lady, I met her for the first time, and she says, we'll take care of him. It'll be okay. I said, yeah, what makes you any different than anybody else out there that's been telling me this? He has dementia. She says, we will. We will love Mr. Albert through it. I looked at her. I hadn't heard love and Albert in the same word in almost a year. I had nowhere to go. I don't know why I was fighting with her. No one was going to take him. I was an hour and 15 minutes away from home, so they decided to take him. It was the most remarkable thing that he moved in on a Monday, and what they did is every time they put their eyes on Albert. Hello, Mr. Albert. And he wasn't having anything of a hug. There was no touching him whatsoever. But every time one of those staff members, it was in a small home, put their eyes on Albert, they'd just say, hello, Mr. Albert. Good evening. Good morning. Can I help you, Mr. Albert? And then about Wednesday afternoon, Wednesday evening, he kind of got the routine. And he saw Joan coming in the house. And he stood up and he put his arms out. Oh. He never had a behavior problem, never had another medication, and short did I know that was only going to be 4 months. Why I mentioned this is for you to understand that this is not bad care that I experienced. It was truly misunderstood care for a disease that is epidemic. They have no training, no ability to know how to interact with this person. And over here with Joan, I saw truly compassionate care. So after Albert passed away, don't know why, I decided I needed a new job. So I thought hospice was being built. What it was an 80-bed memory care assisted living. I didn't know whether or not to hightail it out of there as fast as I could or stay. I decided to stay. I bugged them and told them that they need to hire me. I don't know why. You just need to hire me. I became an administrator a year and a half after that and ran my own memory care building. What do you think I was going to do? Compassionate care, misunderstood care. What the heck? I've got the ability to see if this really works. So I became an administrator. Within that year, it was a deficiency-free building per the state, and we started hugging. Lowered medications, eliminated medications under the agreement of a psychiatrist. I had no behavior problems with any of my residents. And in fact, it was becoming a problem because the state folks wanted to always visit because it was so much fun. We get a little unnerved with that because we're afraid we're going to find something, but they would come and visit because it was fun to be there. So one of the state people was asking one of my residents, who was very prim and proper, and she had lost all her triggers to be polite. Very polite. She would tell me, as I would bend over and pick something up, she says, "Debbie, do you know you have the biggest ass I've ever seen?" So what does the state want to talk to? Who does the state want to talk to? Is Miss Pat. And I'm like, oh my gosh. So she comes up and she says who she is, and she says, "Hey, how you doing here? Do you like it here?" She says, "I love it here." She says, "Why do you like it here?" She says, "It's just goddamn fun here." And there was just a relief because here's the person, it was working. She was going on feelings. She knew she was loved, cared for, and safe. It was amazing how it worked. But Ed and I, 5 years ago, decided we would have a conference and invite caregivers in Citrus County. Everybody told us it wouldn't work. Nobody's going to come out and be public. 200 people walked through that door. This past January, over 200 this year, 5 years later. So we have a conference, and Ed says to me, "You're going to retire tonight, resign." I went, "I'm going to what?" "I've hit the peak. We've got 200 people out here. My building is doing great. It's time. We need to figure out how to get this to people." So I resigned. But I went back to that building 3 months later. And I still wasn't truly convinced of what we were doing. This is why Coping with Dementia was formed, and this is why we're here. I went back to that building, and the minute I walked through that door, instantaneously, my residents that were in the dining room stood up and put their arms out. And they looked at me and said, "Debbie, where have you been?" That showed me that they're in there. So what we want to show you and what our passion is that there is a person here. They're just different. And they're not trying to give you a hard time. They're truly having a hard time.